Hello, I'm Dr. Ray Woods, inventor of FUE and BHT, and about 35 years ago it all began. Fundamentally, it's all about the follicle. I'm here to discuss many issues about the hair transplantation industry, the various procedures, the history, past and present, the practices, and so we got a lot of territory to cover. But fundamentally, it is all about the follicle. It produces the hair. And if it's taken from the donor area, back of the head, or even the chest, or even the neck, it will last for as long as you do, basically. So it doesn't fall out. The thing is, it is a limited resource, and you must treat it very, very, very carefully. It's an incredibly fragile organ. It's soft, it's squishy, it bends, it's mobile. It's surrounded by a thin membrane. It's like a banana in 3D. And like I said, it is mobile. If you touch the back of your head with your finger, it's spongy. If you look at your toes or look up at the ceiling, move your head around, the follicles tend to move, okay? They're not like matchsticks in a box where they'd snap. That ain't gonna happen. It doesn't happen. So when I came into the industry 35 years ago, what they were doing is taking follicles and placing them onto the scalp so they'd grow and give somebody hair. Problem was, nobody could take out individual follicular units containing 1, 2, or 3 hair. They took it out in big clumps containing up to 50 hair. Pretty easy to do. First started in the 1950s with Dr. Orenreich, big 10mm punches. All the hair in the periphery of the cut was destroyed, but at least you had a heap of hair in the center. As I said, it could number up to 50 hair within that large punch. Problem was, it was incredibly traumatic to the donor area, because once you take a hair, it is gone forever and for good. It will never grow back once it is damaged or transected, which I'll get onto. So, and also the aesthetic result is absolutely terrible. I'm sure everyone's seen people, those big doll's hair plugs in their heads. That's what we were getting from that kind of surgery. Thank God that became obsolete. But it was replaced by strip excision. Strip excision meant you cut a large slab of tissue from the back of the head, stitch it up, and then technicians slice it up like sushi, and then pop it onto the scalp. Again, very, very traumatic. I regarded it as medieval barbaric surgery myself, and the results often terrible, because basically you had the strip and you chopped it up, and you could have up to 50 hair per block that you chopped up. Cutting it very finely to give a better aesthetic result could happen, and did happen, but you couldn't get many hair, as I said, in 3D, like bananas, bending in all sorts of directions once you have it out of the flesh, out of the scalp. The scalpel blade is straight. Cutting into follicles which are bending and mobile is very, very difficult. You can get them, but it means you cut through other follicles in front, behind, or to the side of the target follicle. So there's a hell of a lot of damage, and that's why massive scars at the back of the head would be there for very little result. And that was a huge problem. Excuse me. But the strip was still a preferred option to the large punch, because the large punch did so much damage to the back of the head in one hit, or possibly two, you couldn't go back there again. The head was devastated. The back of the head was devastated. The hair was gone. The strip, you could come in and have multiple goes at the back of the head. Okay, and in the end, you could look like a bunch of railroad tracks running at the back of your head and massive damage. But still, the doctor could offer more surgeries. I came along and said, this guy here, the follicle, should be removed individually, one by one. And that was totally new. It was a crazy idea and was met with great aggression and anger. People did not want that to happen, because when they realized what I was doing, that sounded like very, very, very hard work, and it was. The strip excision was quick, it was easy, extremely lucrative, and everybody was doing it, and they got away with those terrible results. Occasionally there would be a good result, but they got away with this kind of surgery because it was the industry standard, or what we call the standard of care. If everybody was doing it, then it's okay. But then again, let's remember, in the late 50s and 1960s, frontal lobotomy to treat depression or homosexuality was considered the standard of care. So things really can get out of hand in the medical industry, and we're seeing it even today. That's another topic. So what everyone was assuming I was doing was coming in with a drill, because no one even conceived that it could be done by hand. And the drill would come in like this, and as you can clearly see, I'm cutting through the follicle. There's a bulb here, so you take out that top section, but it will not survive without the bulb. The bulb contains all the DNA, the brains, everything that is required to make that hair grow. Cutting through the follicle means that section here, transplanted, will not grow. And the bottom section here also dies because it can't grow without the top section. So it's a lose-lose situation. In fact, what I did do, I came in like this and then felt my way around the follicle at different angles and coming in and adjusted the angle of the incision around the follicle, feeling the give in the tissue, coming around like this, and there it is. But that was something which is it's a microsurgical skill. It is a microsurgical art form. It's in the fingertips, and a hell of a lot of practice to do this correctly. But the transection rate, transection meaning cutting through and destroying the follicle, is far, 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 far less. And the limited donor can give you much, much, much greater results. And so I figured no one should be in a hurry. We should get this done and do it properly, but don't rush. Do it correctly. Save your head. And that's what I've been doing all these years. And we'll be discussing more of these aspects in greater detail down the track. We're looking into the hairline, and this is Behind the Hairline with me, Dr. Ray Woods. Thank you.